Hello, this is Dr. Movva Srinivas. I'm a cardiologist. So this is winter 2022. This is already the mid-November. So cold has set in and we are going to have even colder days, even December and January. So this is the time when most of the population, maybe 90% of the population has cold, cough and other symptoms because of the viral infections which come with the cold. So which heralds the viral infection actually heralds the cold. That's what commonly seen even in the West also, but more so common in India because we are a hot country and we are not used to these cold temperatures. That's one. Some people can have allergy to cold, or people catch the viral infections which come with the cold. Mind you, COVID is basically has now become something like a winter viral infection. That's leaving that apart. So now, with the onset of the viral infections, who needs to be more careful? There are some people with very weak heart, the cardiac pumping is low, the ejection fraction less than 30%. These people, plus any people, elderly people. And third category is people with damaged lungs like COPD or smokers' lungs and all these things. So elderly people can have weak lungs without smoking also. With age, the lung function can come down. So coming back to the point, weak hearts, elderly people, damaged lungs and immunodeficiency or immune related problems of any sort. These four categories of people you need to be extra careful, because in normal people what starts as simple running nose can go down the throat sometimes and cause what is called as a throat infection, what we call pharyngitis. In sometimes this even can come down into the lungs, can cause infection. So this is basically how our immunity manages this viral infection. So in healthy people that may stop there. In weak immunity or elderly people with weak immunity, what happen is this infection can go even down to the lungs and cause infection of lungs, what we commonly call as pneumonia. So pneumonia starts as a common cold. So these four categories of people which I just alluded to, you should be extra careful to avoid catching cold. So what should we do? Basically what we should do is what you have been doing for the last 2 years, which have been stressed for 2 years, is wearing a mask. So because the viral infections, of course, if you are allergic to cold temperatures, that's different. But the viral infections commonly come from a source, that's a human source. So, and most people are not decent enough or has good manners to cover their mouth and especially mouth when they're coughing, sneezing. So please be careful when you are in such circumstances, and especially with closed spaces like lifts, closed rooms, cars, when you are in a closed atmosphere of a car and all these places. Wear a mask. So that's what I want to stress. First, wear a mask. Next, most important thing is there are 2 vaccinations apart from COVID vaccination. There are 2 vaccinations which need to be taken by these 4 categories of people, meaning weak heart, weak lungs, elderly and immunodeficiency problems. So these 4 category of people need to take an influenza vaccine every year, because influenza virus can change every year. It's a way the strain can change. So you need to take this vaccine every year. There is another vaccine which needs to be taken every 5 years, that is pneumococcal vaccine. So this needs Pneumovax 23. So this 2 vaccines needs to be given for all the categories of people just I have been telling. So influenza vaccine every year, pneumococcal vaccine every 5 years, so that you will protect yourself from the viral infections. And so influenza protects you from the viral infection. The pneumococcal vaccine prevents you from the viral infection going down to the lungs and causing pneumonia. So wear a mask, take vaccination, so that your basic condition, because just with the pneumonia, this can tilt the balance. Like for example, a weak heart can become weaker, a weak lung can become a fulminant infection, and immunodeficiency can just tilt the balance and the whole system can crash. So please protect yourself in these winter months by taking these 2 measures. Thank you.